on the shores of Northeast Ohio, but boy, did we get a lot this morning with lightning and all that stuff. But it's going to be a nice day later on today once everything clears out. I want to thank you for joining us here on Fox 8 News in the morning. What's in your mouth can say a lot about your overall health. And a local dentist is using dental DNA to help determine if patients are at risk from everything from heart attacks to stroke. Dr. Michael Stern, I want to thank you very much for being here this morning. And this is very, very interesting. And I understand you're one of only a few dentists in all the state that's actually doing this right now. Let's talk about how it works. How can, going to the dentist help in these matters?
Well, if you have a history of cardiovascular disease in your family, heart attack, stroke, if you have any risk factors, like if you're overweight, sedentary lifestyle, etc., and you have some symptoms and your medical stuff isn't maybe doing what you need to have it do, we can actually do a very simple test.
Okay.
You swish some saline, which is in here. We put it in your mouth, you swish it for 30 seconds, spit it into a funnel, goes into a test tube, and then we send it to this lab, and we get pages of information showing the person's bacterial carrier and if they are at risk for gum disease, how would we treat it.
Okay.
A lot of good stuff. We can also do another test to see if you're genetically susceptible. That's a different test.
What type of test is that?
It's done the same way in the office, but they do a different analysis in the DNA lab, and it'll actually tell you if you've got genetic predisposition for this as well. That could be, in advance of symptoms, then some preventive therapy could be done.
Now, if you find out that you have it, then what's the next step?
Well, your doctor or dentist should know what to do to treat the gum disease. There's various different ways to do it. The research has shown that the bacteria live in something called a biofilm, which is like a sticky encasing. So you just can't take pills and drugs to get rid of it. You have to go in there and break it up, which can be done with cleaning in the dental operatory, perhaps. But then you need to keep the biofilm from reforming. Biofilm is what actually causes the heart attack, plaque in the arteries, and strokes and everything.
Talk about the tie between dental health and overall health.
Well, in 1997 at SUNY at Buffalo, some guy went into the OR where they were doing cardiac bypasses, and he actually cut the bad artery out, and he put it in a microbiology lab, and they found dental bacteria in there. That was in '97, and it took 10 years before it showed up in the New England Journal of Medicine. And most physicians are still not into trying to get this other link done. They're more into treating the symptoms. We're more into trying to prevent it from happening, Wayne, and also trying to treat the cause.
Now, what's this right here? You also have this.
Well, this is something that is used as a medication carrier, and this is a little different also. There aren't a lot of doctors doing it. A lot of people have had gum surgery and stuff. It may not work long term. This is a little tray that's almost like a whitening tray, but instead of keeping stuff on the teeth, it forces stuff into the gums, and it kills and breaks up the biofilm. And this can also be used preventatively as well. This can take the place of a lot of more invasive treatments such as surgery. Can also prevent gum disease from reoccurring as well.
Talk about just the importance of good dental health.
Well, they just say, as so goes the mouth, so goes the body. In our office, if people aren't brushing or flossing, we'll say, well, just brush and floss the teeth you want to keep. And, once they're gone, they're gone. You really only have one crack at that. But bacteria do go from the mouth into the rest of the body. That's the connection that's been longly ignored and overlooked.
Now, if you take care of your teeth, can they indeed last a lifetime?
Barring an act of God, I would say yes, they can. Occasionally we see things that happen that are beyond our control, such as cracked teeth, but I mean the diseases that are causing dental decay and gum problems are microbiologically done, and I have a degree in microbiology, which is why I'm in this thing heavy, more so maybe than a lot of other doctors. Kill the germs, you can't have dental disease.
That's the bottom line.
Yes, it is.
Kill the germs. So this is a preventative thing, basically.
It can be preventative, but it can also treat the problem as well, Wayne.
Treat the problem. Dr. Stern, I want to thank you very much for joining us.
My pleasure.
Always good to see you. Always good to see you. And we have linked Dr. Michael Stern's website to ours. All you have to do is head to our website, fox8.com, and click on the AM show for details. Want to check in now with Kenny Crumpton, who is hanging out in the foundation room at the House of